Today's date is August 24th, 2022. I'm going to perform my head to toe assessment. First, I'm going to start by inspecting the skin of the head, face, neck, anterior chest, posterior chest, abdomen, bilateral arms, and bilateral legs. Skin is warm, dry, smooth. There's no edema. Skin turgor is non-tinning. There's no lesions, bruising, scars, or nevi noted. Next, I'm going to inspect the head. Head is midline, symmetrical, sitting in the correct position. Next, I'm going to palpate the head for any tenderness. Is any of that tender?
No.
Hair is brown, soft, smooth, it's evenly distributed. There's no swelling, deformity, depressions, infestations, or lesions noted on the head. Next, I'm going to palpate the temporal arteries for tenderness. Is that tender?
No.
All right. Next, I'm going to palpate my lymph nodes, pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Lymph nodes were non-palpable and there's no edema or redness noting. Next, I'm going to palpate the TMJ. Can you open your mouth? Close. Is that tender?
No.
There's no tenderness, crepitus, or nodules noted on palpation of the TMJ. Next, I'm going to palpate the masseter muscle. Clench your jaw. All right. Strength is 505 symmetrically of the masseter muscle. Next, I'm going to assess light touch. Close your eyes for me. Tell me when you can feel this.
Feel it, feel it, feel it, feel it, feel it.
Okay. Light touch sensation is intact. Cranial nerve number 5, which is trigeminal, is intact. Next, I'm going to move on to the ears. Ears are in the correct position. There's no deformity noted. I'm going to palpate the pinna and the tragus bilaterally for any swelling or tenderness. Is that tender?
No.
Is that tender?
No.
Tenderness or masses. I'm sorry. There's no tenderness or masses felt on palpation. Next, I'm going to use my otoscope to assess the tympanic membrane. Tympanic membrane is pearly gray. There's no perforations, swelling, or erythema noted. Next, I'm going to assess the hearing for the patient using the whisper test. Repeat what I say.
Thanksgiving. Christmas.
All right. Next, I'm going to perform the Weber test for lateralization. Tell me if you can hear this in one ear or both ears.
Both.
All right. Next, I'm going to perform the Renee test. Tell me when you can no longer hear this.
Can't hear it. Can't hear it. Can't hear it. Can't hear it.
All right. The Weber test is normal. There's lateralization to both ears. And the Renee test, air conduction was greater than bone conduction. Cranial nerve number 8, which is auditory, is intact. Next, I'm going to move on to the eye. Eyebrows and eyelashes, hair is evenly distributed. Eyelashes are pointing outward. Palpable fissures are symmetrical on both sides. Next, I'm going to inspect the sclera and the conjunctiva. Sclera is white, conjunctiva is pink. There's no lesions or discharge noted. Next, I'm going to do a visual acuity with my Snellen chart. Close one eye and read the lowest line you can read.
LFTPH.
All right, next.
LFTPH.
And then both eyes.
LTFPH.
All right, vision is 20/20 in both eyes. Next, I'm going to assess peripheral vision. Close, yep, and then. All right, and then tell me when you can see this.
See it.
All right. Next, I'm going to assess direct vision. Tell me what this is. How many?
3, 2, 1, 2.
All right. Cranial nerve number 2, which is optic, is intact. Next, I'm going to assess my pupillary responses. All right, just look straight ahead. All right, pupils are equal, round, and reactive to light and accommodate pupils are equal, round, and reactive to light, direct and consensually. Next, I'm going to assess accommodation and convergence. Just follow my finger to your nose. All right. All right, pupils accommodate and converge bilaterally. Cranial nerve number 3, which is ocular motor is intact. Next, I'm going to assess my 6 cardinal gazes. Follow my finger with just your eyes. Okay. Cranial nerve number 3, which is ocular motor. Cranial nerve number 4, which is trochlear, and cranial nerve number 6, which is abducens, is intact. With the patient following all of those movements. And I'm going to now use my ophthalmoscope. All right, just look straight ahead. All right, red reflex is present. And the optic disc is visualized. It's a orangish pink, orangish yellow color with clearly defined borders. Move the other eye. All right, red reflex is present, and again, the optic disc was visualized and had orangish yellow color with clearly defined borders. Okay, next I'm going to move on to the nose. Nose is midline straight, no deformity. Blow out one nair, blow out the other. Nairs are patent. Next I'm going to ask the patient to close his eyes and tell me what this smell is.
Coffee.
Sorry. Cranial nerve number 1, which is olfactory, is intact. Next, I'm going to palpate the frontal and maxillary sinuses for tenderness. Is that tender?
No.
All right. Next, I'm going to move on to the mouth. I'm going to ask the patient to open his mouth. Lips, teeth, gums, buccal mucosa, salivary ducts are patent. The floor, lift up your tongue. Floor of the mouth and soft palate are all intact. There's no lesions, bruising, discharge, no bleeding at the gums. Patient has good dentition. I'm going to ask him to open his mouth and say, ah. All right. Tonsils are 2+, and there's no redness in the posterior pharynx. Uvula and soft palate rise symmetrically with phonation. So cranial nerve number 9, which is glossopharyngeal, and cranial nerve number 10, which is vagus, is intact. Next, I'm going to ask the patient to stick his tongue out. All right, there's no fasciculations with tongue protrusion. So cranial nerve number 12, which is hypoglossal, is intact. Next, I'm going to move on to the neck. Neck is, I'm going to palpate the trachea. Trachea is midline. Next, I'm going to palpate the thyroid. Swallow for you. All right. There's no nodules felt on palpation of the thyroid. Next, I'm going to assess carotid pulses. Turn that way a little bit. Okay. All right. Carotid pulses are 2+. Next, I'm going to assess for bruits over the carotid with the bell. No bruits were heard on auscultation. Next, I'm going to ask the patient to turn around. We're going to move on to the, watch your head, posterior chest exam. I'm inspecting for any signs of increased worker breathing, such as retractions, tripoding, use of accessory muscles, cyanosis, tachypnea, which I do not see. Chest wall, I'm inspecting. There's no obvious deformity. And it's symmetrical on both sides. Next, I'm going to palpate for chest wall, symmetrical chest wall rise. Deep breath, good job. All right, next I'm going to assess for tactile primitus, say 99.
99.
All right. Chest or tactile primitus is intact or is symmetrical. Next, I am going to percuss all my lung fields. Resonance was heard on percussion, which is a normal finding. Next, I'm going to just listen with my stethoscope in all lung fields. Alright. Bilateral breath sounds are clear. Next, I'm going to perform egophony, bronchophony, and whisper pectoriliquy. When I just say E.
E, 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 E.
Alright, and then say 99.
99, 99, 99, 99, 99, 99.
And then whisper 99. Alright, there was no signs of consolidation heard on these exams. While we have the patient in this position, I'm going to go ahead and do CVA tenderness. Does that hurt?
Nope.
Alright, CVA tenderness was negative. You can turn back around. I'm going to inspect the anterior chest wall is symmetrical on both sides. There's no obvious deformity noted. Next, I'm going to palpate for symmetrical chest wall expansion. Okay. Okay, and then say 99 tactile
99,
frematus.
99, 99.
Alright, tactile frematus is symmetrical on both sides. Next, I'm going to also take my anterior lung fields. Alright, bilateral breath sounds are clear. Next, I'm going to move on to my cardiac exam. I'm just going to go ahead and call out the auscultation points of the heart and localize them, and then I will perform my exam. Second intercostal space right of the sternal border is aortic. Second intercostal space left of the sternal border is pulmonic. Third intercostal space left of the sternal border is Erb's point. Fourth intercostal space left of the sternal border is tricuspid, and fifth intercostal space left of the sternal border mid-clavicular line is the mitral valve. This is the point of maximum impulse. I'll go ahead and palpate that, which I can feel now. Next, I'll go ahead and listen with my diaphragm first. All right, and then the bell. All right. I will listen for a full minute at the mitral valve, regular rate and rhythm. There's no murmur, gallops, or extra heart tones heard, and S1, S2 was heard. Regular rate of 60 beats per minute. Next, I'm going to move on to my abdominal exam. Or I'm going to repeat. I'm going to have the patient sit up to 30 to 45 degrees. All right, sit back just a little. And I'm assessing for any JVD. There's no jugular distension or jugular pulsation noted. Now I'll have the patient lie back. And I'm expecting for any heaves or lifts, which I do not see. Next, I'm going to palpate for any thrills over these auscultation points of the heart. All right, no thrills felt on palpation. Next, I'm going to repeat my cardiac exam with the diaphragm. Okay. All right. Once again, regular rate and rhythm, no bruits heard or extra heart turns. Next, I'm going to move on to my abdominal exam. Abdomen is flat, symmetrical on both sides. Next, I'm going to auscultate over the arteries. First, I'm going to start with the aortic, renal. Oh, I need to use my bell. Aortic, renal, iliac, and femoral, sorry. All right, no bruise or hurt on auscultation. Next, I'm gonna listen for bowel sounds in all 4 quadrants. Vowel sounds are normal, active in all 4 quadrants. Next, I'm going to percuss. All right, Tiffany was heard over hollow organs. If I was over a solid organ, like the liver or the spleen, I would hear dullness. Next, I'm going to palpate for any tenderness or masses. See this tender? No tenderness or masses felt on palpation. Next, I'm going to palpate for the liver and the spleen. The spleen's over here on the left, so take a deep breath. All right. Next, I'm going to do the liver. Same thing, take a deep breath. Blow it. All right. Liver and spleen are non-palpable, which is a normal finding. Next, I'm going to move on to my musculoskeletal exam. I'm going to start by inspecting the joints of the hands, wrist, elbows, and shoulders. They're symmetrical on both sides. There's no tenderness, swelling, redness, tenderness, swelling, deformity, crepitus, or nodules noted. Next, I'm going to assess my radial pulses, 2+, cap refill is less than 3 seconds. Next, I'm going to assess range of motion of the fingers, flexion, extension, hyperextension, abduction, adduction, finger opposition. Okay, next we're going to do wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. All right, next we're going to do elbow, flexion, extension, hyperextension. Okay, next we'll do shoulders, flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, internal rotation, external rotation. All right, patient has full range of motion of the hands, wrists, elbows, and shoulders. Next, we're going to assess the strength of these hand grips. Squeeze my hands. All right, and then flex against me. All right, and then extend. All right, and then abduct away, and then adduct toward me. All right, and then shrug your shoulders against me. All right, cranial nerve number 11, which is accessory, is intact. Patient has strength 5 of 5 in all of the upper extremities. Next, I'm going to assess light touch. Close your eyes. Tell me of the upper and lower extremities. Tell me you can feel this.
Feel it, feel it, feel it, feel it.
Okay. Next, I'm going to perform stereognosis and graphesthesia. Stereognosis, tell me what this item is.
It's a key.
Okay, and then your right hand, tell me what this item is.
This quarter.
Okay. And then graphesthesia, tell me what letter this is.
A. B.
All right. Those exams are intact. Next, I'm going to assess cerebellum coordination, rapidly hand flop. Okay. Oh. And then rapidly fingers, and then rapidly finger to my finger. And then do your other hand. Okay. Cerebellum coordination is intact. Next, I'm going to do my, there's no edema in the upper or lower extremities, and skin is intact there as well. Next, I'm going to do my deep tendon reflexes. So brachioradialis. Okay. Okay. And then bicep, relax. Okay. And then tricep. Okay. All right. And then patellar. Okay. And then Babinski's. I'm sorry. And then Achilles. Let's see if they can see. Just relax. Okay. And Achilles. Okay. Deep tendon reflex are intact. Next, I'm going to assess the joints of the toes, ankles, knees, and hips. There's no redness, swelling, deformity, crepitus, nodulus, or tenderness noted. Cap refill is less than 3 seconds. I'm gonna scoot this back a little bit. Pedal pulses are 2+, posterior tibialis pulses 2+. Next, we're gonna do range of motion of the toes, flexion, extension, abduction, adduction, okay? Ankles, plantar flexion, dorsiflexion, inversion, eversion, just your ankle, not your whole leg, and then rotation, okay? And then for the knees, flex against me, okay? And then push against me, okay? And then abduct away, and then adduct toward me, okay? Patient has, okay, you can stand up now. Now we're gonna do range of motion of the hips, flexion, extension, hyperextension, abduction, adduction, inversion, eversion. All right, next one. Flexion, extension, hyperextension, inversion, eversion, abduction, adduction. Okay? And for the knee, flexion, extension, hyperextension. Flexion, extension, hyperextension. Okay, patient has full range of motion of the toes, knees, ankles, and hips. And strength of 5 is 5 of 5. Next, I'm going to assess the spine. Spine is aligned properly. Bend over for me. All right, there's no tenderness or deformity noted on the spine, no scoliosis noted. All right, you can stand back up. Next, we're gonna assess range of motion of the cervical spine. Flexion, extension, or this is flexion, extension, hyperextension, lateral bending, rotation. All right, next we're gonna do lumbar spine, flexion, extension, hyperextension, lateral bending, and rotation. All the way around, okay. Full range of motion of the cervical and lumbar spine. Next, we're going to just do a normal gait, walk towards me. All right, and then do a tandem gait, which is heel to toe. All right, good, good. Next, we're gonna do hop on one foot, and then the next foot, and then put your legs together, arms together, by your side, arm out to the side, close your eyes. Romberg test is negative, and that concludes my head to toe assessment.